Hello everybody and welcome to today's University of Portsmouth Q&A event titled COVID-19 Keeping the Community Safe. I'm Mark Walton, editor of the News in Portsmouth, and I'm delighted to have been asked to be moderator for this session, which has been initiated by the university as an opportunity for members of our community to ask questions about the measures it has put in place to minimise the risk of coronavirus. There was much debate leading up to the autumn on what impact the start of new university year and the return of students to cities like Portsmouth would have on the number of COVID-19 cases. We remember the initial reports from places such as Manchester Metropolitan University and the University of Glasgow as film crews showed students under lockdown as they returned to their halls of residences. Locally at the News, we've devoted more coverage to the extensive changes made by the university to its campus to keep students, staff and the community safe, including 2 COVID-19 testing sites, temperature scanning inside buildings, enhanced cleaning around the campus, and a smaller number of staff and students on campus at any one time. These steps have been taken by the university in connection with key partners across the city, including Portsmouth City Council, Hampshire Constabulary, University of Portsmouth Students' Union, and Portsmouth Hospitals University NHS Trust. And today we have a leading panel of experts from many of these partners on hand to answer your questions. Questions have already been submitted ahead of this event by people who have signed up, but you too can ask your own question online during this event. And if you look to the bottom right of your screen, there should be a little Q&A button. So please press in there if you've got a question you'd like to ask. We'd love to hear it. I'll say now that we probably won't be able to ask every question that comes in, because we've got a number that have been submitted already. We've got a quite packed schedule this afternoon for the next hour or so. So we might not be able to go through all of them, but I'll try and get through as many as possible. So on that note, without further ado, I will introduce you to today's panelists. So joining us today are Inspector Marcus Kennedy from Hampshire Constabulary, Councillor Susie Horton, Cabinet Member for Children, Families and Education from Portsmouth City Council, Helen Atkinson, Director of Public Health from Portsmouth City Council, Rama Haluni, who's the University of Portsmouth Students' Union's elected officer, and last but by no means least, Professor Graham Galbraith, Vice-Chancellor of the University of Portsmouth. So I said, without further ado, we'll head straight into the questions. So Graham, this first one to you, and it's the one that people will say is, why can't students just stay at home and learn online rather than potentially bringing COVID to Portsmouth? So that one to yourself, Graham.
Thank you. It's a really good question, and obviously one that we've thought about a great deal. But when you reflect on what our young people have experienced over the last year, having A-level exams blighted, GCSEs blighted, and frankly, we owe it to our students to give them the highest quality educational experience. After all, our students are our future. And I think it would be irresponsible for us to further blight their education by not giving them the experience that they deserve. And of course, students want an element of face-to-face. It's part of the experience of being a university student. And of course, there are many of our programmes of study where a part of their learning is practical, hands-on experience, whether it be an engineer studying in our laboratories, whether it be the scientists who will be the future of learning about viruses in a biological lab. And so it's really important that we give students that experience. But what we've done is we've minimised the amount of face-to-face to the very smallest amount possible, which maintains the integrity of the programme. Of course, if we have to go fully online, we would, but frankly, we'd rather not, because we would rather give students that experience that they're paying for, and frankly, they deserve.
Okay, thank you very much, Graham, for kicking off with that answer. Just on that, you've talked about your responsibility to the students. Part of that responsibility is also looking after their mental well-being, looking after their pastoral care. And I see just today, there was actually, I think the British Safety Council is actually calling on the government to take control of the situation where students are isolated in halls of residence so say living on junk food and living on fear. So what are you doing as a university, and what actions are you taking to ensure that the physical and mental well-being of the students who find themselves in this situation are being taken care of?
Yeah, well, I'd want to begin by saying, my responsibility and the responsibility of my colleagues is for our students. It's also for our staff, and it's actually for the whole community of Portsmouth. I just want to emphasise that it's in no one's interest that there are outbreaks in the city at all, and it's the last thing we would want. So it's important to appreciate that all our planning is based on the response of the whole community. In relation to students in self-isolation, I'm really proud of my staff and the Residence Life team, because right from the very beginning, before students even appeared on campus, we were planning for what would happen. And so we unlike other universities, provide free food parcels for students in isolation, because we don't want students tempted to break their self-isolation and go out and get food. So we're providing food for them, and we're providing it free, because we believe that is morally the right thing for us to do. And secondly, we are doing once every 2 days, contacting every student in self-isolation by our counselling team to make sure that they are okay. Because again, it is in no one's interest for a student to become seriously stressed about the situation. We want the self-isolation period to be one that is not so onerous that students are tempted to break it, because that would be a really big mistake and would be bad for our staff, for the other students, and for the wider community. And so far, I have to say, our students, I cannot praise them enough. I mean, I've seen some images of up in Coventry University, mass parties and all that kind of thing. It's not been like that in this city. Our students have been incredibly respectful and responsible. However, you will always get the one or two exceptions, but then you get that one or two exceptions, don't you, within the wider community as well. So I'm very proud of the way that they've been behaving, but I'm also think part of that is because we are making a superhuman effort to make sure that self-isolation is not a completely miserable and mentally draining experience for our students. And I think that's critical.
Thank you very much, Graham. So yeah, you did very much looking after your students, but also seeing those as part of the wider community, which they are. I'd like to bring in Helen at this point as you Director of Public Health. I just wonder how closely on a day-to-day basis you do work with the council to make sure that it is, with the university, to make sure that it is one community acting together to do what we can do to minimise the risks.
Thank you, Mark. Yes, we've been working very closely with the university in Portsmouth City Council and specifically in public health since the first wave. So really since the first cases in February, March. I've been very impressed with how the university has balanced, which is a very difficult juggling act to do, which is both ensuring the safety of the students and staff and therefore also the community, versus really understanding and meeting the emotional well-being needs of the students, particularly this term as things have as things have across the country really started to heat up in terms of the infection rates going up. So I think it's a really difficult balance, but we've been working with the university, and we've been during the summer exercising the plans to ensure that the university are following all of the public health guidance with their students around socially distancing. And then when we have had cases through the social isolation within the halls, but really ensuring that it's really only those that need to socially isolate to protect other students and community, so that it's limiting, I suppose, the long-term emotional welfare impact on students that are already following the guidance in terms of social distancing and don't need to self-isolate. So I think we've had a very measured approach together, working very closely, and also importantly, because communications are the key, we've been working with the university and with the student union to ensure the correct communications are out to students so that they understand what they need to do. So yes, I think we've worked well, and I think we've been assured which is, again, I think, as Graham says, why we haven't seen the number of cases yet that some other parts of the country have seen in terms of the student halls having to, all halls having to basically shut, and students being self-isolated and not being able to get access to food, etc., and support. So yes, we're in a good place, but we're going to have to continue that work as we move into winter and the infection rate increases.
Thank you, Helen. Yes, it is a good place that we do hope continues as much as possible. As you say, you've worked in partnership with the university. Plans have been put in place, but at the end of the day, sort of relying heavily on the students themselves. So Rama, from your point there, as part of the Students' Union, and Helen said that you've been in consultation with them, how proactive have you been in discussing with students and looking at the responsibilities of students? And how well do you think the city has come together to make this as safe an environment as possible?
Yeah, in terms of collaborating both the community and the university, we have worked a lot around the communication that's going out to students. We don't want it to seem as though we're blaming them for anything of that sort, but we do want to emphasise the importance of coming to Portsmouth and joining the community and that responsibility that comes with it. So we have been quite both firm and making sure that they have the support that they are warranted to have, both from our wellbeing services, Res Life, and also their personal tutors has been quite important, so that it's not, so isolation isn't as isolating mentally. In terms of, I can only echo what Graham has said. The behaviour has been so good, and I know the police and the university have had a lot of communication around that. So it's been very, very positive, and like we said, there has been a few cases of students breaking the rules, but alongside any of this sort of situation that's happened, there will be exceptions, and I think we have been doing quite a lot around providing students with things that might not make them lonely or might not make them bored, because we do know boredom does mean that they're more likely to break rules or something like that. So we have kept that in mind, and we have been trying to give them a lot of what the student experience used to be in terms of during their isolation. So we have done quite a bit.
A lot of preparation going on there in the background, and thank you very much. Susie, from your role as education lead on the council, I know you wanted to come in and add to the debate at this point.
Yeah, I just want to echo what Graham had said about the importance for these young people. I mean, it's as a percentage of their life, it's getting bigger and bigger the longer this goes on, and it's really important that I think we do everything we can to support them, whether they're homegrown students or not. And the other point I really wanted to make is that there's always a lag to these decisions. So the decision was made that students would go back to university, and the university took that really, really seriously, worked with the council on all the measures that Helen has outlined in terms of safety, COVID safety, but also they are residents of Portsmouth. And as we know that, I think it's about 25%, maybe even more, who actually make Portsmouth their home in the future. And so they are our residents from the moment they come in. So yes, I think people need to be aware that when something happens, that actually there's been many months preceding it, and we're in a really unusual situation where even with the best planners, things are changing rapidly, and we have to put that in context.
Yeah, indeed. So we've seen things change very quickly in a short space of time. So it's been fleet of foot as well. Graham, if I could bring you back in at this point as well.
Yeah, it's just really to add in that it's not trite, the phrase that we're all in this together, and I mean that quite seriously, because all of us in the community have a role to play, and be absolutely clear that as Vice Chancellor, I will throw all of our disciplinary procedures against any student who breaks the rules, because that's just not acceptable. But it's not just about the students, about the whole community, and I do get really saddened when I hear our young people being vilified, when the majority of them are actually trying to do the right thing, because they're as nervous as anyone else about the virus and its impact. When We set up our asymptomatic testing. We had students queuing there, and I was saying, why is it that you've decided to get tested? Because it's not a very pleasant thing. And you know, I had students saying, well, I've come from Cornwall. I don't want to be the one that brings infection into this city. I don't want to be the one that infects my friends and mates that I'm living with. So I'm actually quite bowled over by the maturity of many of our new students as they arrive and the way that they behave. But I would really emphasise that working together, I think, is part of our success in this city. I can tell you that it's not every Vice-Chancellor that can put their hand on their heart and say that we're working in complete collaboration with our City Council, with our local hospitals, with our public health. And that is what's happening in this city. So we should all be very proud of the way that the agencies are all coming together as one team to try and fight the effects of this virus in the city. And long may that continue.
Yes, thanks, Graham. Yeah, I think one of the beauties of this city, not just in this situation of how we do pull together. You talk about working with the various agencies. One of the agencies we haven't pulled in so far is Hampshire Constabulary. So I'd like to bring Marcus in at this point, just to get a feel of how closely you've been working with the university, but also, you know, Graham pointed out there that the majority of people are doing what they're told, some don't, and that's in all walks of life. And we have seen occasions of, you know, queues of youngsters outside nightclubs, outside pubs, not saying they're necessarily students, but you've got a difficult act trying to police this situation with a lot of young people who want to be young people, who want to go out and have fun. So I'd just like to hear your thoughts on the police's role in the current situation.
No, that's brilliant. Thanks, Mark. Let's just check my audio is okay. Can everyone hear me?
Loud and clear, thank you.
Perfect. Yeah, so I've been involved from the start of the process of return to students with Bernie Chopham at the university and Fiona Hawes and with the council. And I can mirror what everyone's saying is that we have been pleasantly surprised by how well behaved and well done and how people are adhering to the guidance as it changes week by week around the halls and around the nighttime economy hotspots. So if we take the halls, for example, when the students first started coming in over the period of the weeks, I was attending the halls and engaging with the parents and having a chat, and I think I got a real good tone for how nervous families were about their students returning. A lot of emotional families outside saying goodbye to their loved ones, not both parents being able to go into the halls, just one at a time. And for me and my teams, that's a really good example to pick up on the tensions around nervousness of the students coming back. It's a double-edged sword for us because we need to ensure that people adhere to the law and are adhering to the COVID policy to reduce the infections. But we're also really, really mindful in the city, the police, that the students bring a lot of culture, energy and finance to the city. So we need to welcome them back and make sure it's in a safe environment. So that's why we've timed in with the union and the council. That's why we've increased our nighttime economy patrols around the Guildhall, around those nightclubs. And yeah, there was that odd photo opportunity when Astoria first opened up with extensive queues and they weren't social distancing, but our licensing team got in there quick with the council and spoke to them. So that queuing is now being adhered to. And generally, when the obviously in the last few weeks, the legislation changed for kick-outs being 10 o'clock, which we thought would present us more of an issue than it has in terms of large numbers spilling onto the streets. But again, Guildhall, where the students have come out and they've been in groups of larger than 6, they're listening and they're engaging and they're moving on. So I can generally say so far so good. Even houses of multi-occupancy, we've had the odd party that we've had to engage with. Halls predominantly been very good. We've done some QR codes on cards with the university for engagement process, which have gone down really well. So, you know, all I can emphasise is that I think the strategy to engage us with the university and council early doors has worked. And I will refer most people to when you were at school, it was always the 5% spoiled it for everybody else. I would say it's the same in all walks of life, the same as students. When a couple get it wrong, they're the ones who grab the headlines, but I think I'm comfortable saying the majority are engaging and listening and understand what was part of them. And I've been really pleased with that so far.
Thanks, Marcus. You touched on there about students in houses of multiple occupations. So with the halls of residence, you know where they are. When they're in the city centre, in the Guildhall Walk, whatever, we know where they are. But there's a lot of students living together in houses dispersed across our city. So how tough is that to police? Are you getting calls from people worried about parties happening? How does that work?
Totally. Not predominantly, but the problem is if you have a party at a house over a Friday, Saturday night, if that's called through to our control room and they're saying, yes, there's more than 6 people at a party, we've got to balance that off against other high risk incidents. So, domestics, fights, other burglaries, etc. So we've got to balance, where does that balance on our risk matrix to deploy officers? So, but we are conscious that it does need a deployment too. I think what you'll see now is that if we did get more reports of those house parties, of which there haven't been many, we may be moving our priorities towards getting to those locations and dealing with those robustly, because priority is to reduce the spread of the infection. If we get those house parties, then we will be issuing fines at some stage with that if breaches are deemed to be there. So it's a balancing act for us. We've got to balance risk across the city. There's only so many police officers to go to so many jobs on a weekend. But that said, it is now becoming more a priority that if we do get reports of house parties, people are deemed to be breaching, those details will be taken, those details of the students are passed back to the university, and we will be issuing fines where people have been blatantly breaching.
Okay, thank you very much, Marcus. So you're prepared to get tough on them, but it sounds like you're working well at the moment and getting, when you've confronted these issues, you're getting a good reaction from the students as regards knowing what the
I think
responsibility
that tone, you would have heard of the 3 E's and the 4th E of engage, educate, explain, and then enforce, which is the fine. Across Hampshire, we will be moving a bit faster towards that enforcement element now to ensure that we reduce the spread of infection. So while we know we are not in those higher tiered systems for Hampshire yet, reducing the spread of infection is our priority. And so if that means more enforcement coming forward, then that's going to happen across the board, not just for students, but across the city.
Okay, thank you very much, Marcus. Also, thank you for Pam who submitted that question and put that into our chat section. Pam also asked about, obviously, as regards students being out in the wider community. Graham, how easy it is for you to keep a check on those people? Again, do you know where all the students are? Do you know where the positive cases are? Can you give them the level of support you can do for people that you know are in student accommodation?
Well, we try to, and we know where most students are, but of course not necessarily all. And of course it is more difficult when students are distributed into houses of multiple occupancy. But of course we've got a very good residence life team, and we've got a very good central team where if individuals are concerned about something that is going on, they can contact that team and contact the university, and we will deploy our own resources. Of course, we can't enforce fines. We can't do what the police can do, but we can exert pressure on students if we feel that behaviour has been reported, that it's not acceptable behaviour, outside the normal environment. But as I say, so far, the great irony is, I would say, the reports of incidents are actually less this year than they would be in a normal year. And I do think that does reflect the fact that, students and their families are human beings. They, after all, are just the sons and daughters of people like you and I. My son's a student at university, and yes, they are young people and they behave like young people, but they also are nervous. They also don't want to contract the virus and spread it onto their own family when they go back home. So I think, yes, there is always going to be the exception. I honestly can't do much about that. There will be the exceptions, as there are in the more general population. I think it's really important to continually hammer home the message to the whole population that this is us looking after our city. This is us looking after and caring for each other. So for goodness sake, abide by the measures that are there. And that's the best thing that we can do, is wear face masks, apply social distancing, wash hands regularly. And if we all do that, then I'm confident that we will continue to keep the infection rates down in the city safe.
Thank you very much, Graham. Yeah, thank you for that, and thank you, Marcus, for your input as well. We'll move the conversation on now, and we touched on earlier that we're living in a very ever-changing circumstances, and just reading the latest report in The Guardian, I think it was yesterday, where they're saying that ministers are looking at plans moving further forward ahead and potentially want the idea that universities should be placed into lockdown for 2 weeks before Christmas. So all the students stay off campus, almost go into quarantine for 2 weeks before we send them home to their loved ones at Christmas. Just wonder what your thoughts are on that one, Graham.
Yeah, excuse me laughing slightly, and I shouldn't, because that is what's being said. I actually haven't heard of a more ridiculous and absurd suggestion in all my life, to be honest with you. I mean, I don't know whether people recall what happened when they took that kind of approach in the early days with the cruise ships. That helped a lot, didn't it? Because what that did is it just helped everybody to get infected. Great idea, very, very effective. You know, and the fact that that proposal has never been discussed or mentioned or floated with the universities bodies, UUK, or anyone in universities, and it's really depressing that they choose a date that happens to be the term end date for Oxford and Cambridge, and they don't seem to know that other universities have different end dates and maybe don't all end term at the same time. So I'm against that. I mean, what I do think is that we need to do something about testing and tracing, because the obvious way to allow students to go back home is to test everybody and check that they are safe and not carrying infection, or even better, to do an antibody test, which will tell us whether they have had the virus and are carrying antibodies. And therefore we could actually say to students, not just you're safe to go home, but you can go home and you can hug your grandmother, because you won't pass on the infection. And, you know, there are things that we can do that would be proactive and positive, not just to support students, but to support the wider community. And I really do believe that's where the debate should be, not an ill thought out and ridiculous suggestion like lockdown universities at Christmas for 2 weeks. It also misses the point that many of our students don't go back for Christmas. Many of our students will stay in the city over Christmas. So is their education to be blighted and a few weeks of their teaching taken off them, when in actual fact they have no desire and won't be going back home because they may be international students, or they may not have a home to go to because the university might well be their home. So I must admit, it really does disappoint me when I see ill thought out things coming from government, because it simply causes a reaction of furore and a lot of wasted energy, energy that could be better put in doing things that really will make a difference.
Thank you, Graham. I almost feel guilty for asking.
I feel quite strongly.
It didn't come across that way. I say I almost feel guilty for asking the question. Susie, from your position working in local government, your views on how well the sort of central government, local government are working on issues and plans and thoughts in the education area?
Well, forgive me for not responding to that particular issue with any urgency, because I'm waiting for all the U-turns to happen before we actually take any steps to doing that. Having supported teachers over the last 8 months and realised, and you know, Graham's got a really good point there, is that at the beginning people were taking these announcements seriously and putting in a lot of effort and energy, only to find that actually it hadn't been thought through. So on that one, what are we? I'm looking at my calendar, the 15th of October. I'm going to wait a while before we make any decisions on that. But in all seriousness, I think, you know, we do need to weigh up these decisions. They're massive decisions, and actually there does need to be more leadership and responsibility shown by you know, central government for the whole country. But when these announcements are made, there does need to be more detail and more understanding about the other impacts of those announcements, not just on local government and big organisations like the university, but also individuals as well. I mean, drill down, what does that experience do for that individual student, for example, as well as other people involved?
Thank you very much. Thank you, Susie. There was a touch on there as well on test and trace and making sure that the health systems are as robust as possible. So again, Helen, if I could pull you in as our Director of Public Health, where are we heading to as regards safety measures, testing, tracing, anything else that you can do from your role to ensure that the passage moving forward is as smooth as it can be?
Yes, thank you, Mark. So obviously through the first wave, we didn't have test and trace been coming over the summer as one of the very important measures, alongside, as Graham so eloquently said. I've obviously done a good job of Graham has got all of the measures of PAT, you know, along with hand washing and social distancing. And it's really good that we will shortly be actually starting to take a more explicit leadership role around test and trace locally in the local authority. So you'll be aware that test and trace, there is both a national test and trace system, and then locally the more complex contact tracing happens with our colleagues in Public Health England. And hopefully from next week, we are taking a role also. So we have agreed and gone into an arrangement with Public Health England where we will be following up in local authority within my team those confirmed cases that have not been contacted within 72 hours. So initially we're going to just focus on 72 hours, but as we get settled in and the team gets going, we will then move to 24 hours. And the point of us doing it alongside our colleagues in Public Health England is that we do have obviously a better understanding locally of our city, of our population, and will maybe have better contact details for those that haven't been able to be traced. So it's part of what we're doing to support the national test and trace programme, and alongside obviously having the app. And can I say that I've been impressed working with the university and the student union about their how they have taken up use of the test and trace app, ensuring that all of their students are using it. The students through the Eldon Road local testing centre, as well as the asymptomatic testing that the university are doing with the Portsmouth Hospital University Trust. And, you know, as of today, we have got cumulative cases of 1,023. But it's important to note that, you know, testing is available. I know there have been some issues recently in terms of access, but I want to use today as an opportunity to say that it's all back on stream, and it was mainly not the testing sites that were the issue. There was some lab capacity issues nationally as the demand for testing. So the demand for testing has hugely increased, and I think will now continue to increase over the next few months as we very much move into winter and increase cases. So we hopefully will have a second local testing site set up in the north of Portsmouth shortly. That's just getting the go ahead as we speak. And of course, people can also use home testing kits to apply. So there are no longer delays, and people should be able to get a test. And I just want to point out, people who are symptomatic, we're encouraging to get the test, because your test result is only for for that week or that day. And it's important that you are actually going for testing when you are symptomatic. So altogether, these measures, including social distancing, hand washing, and if you become symptomatic, getting tested quickly and self-isolating, are the important measures, as Graham says. What we're trying to do is recognise we are now in the second wave of the pandemic, and we will see increasing numbers locally as well as regionally and nationally. But it's still important to manage the infection rate as much as we can to keep our residents, including our students, safe, and that is by following the measures. And you'll be aware that nationally, government have introduced these 3 tiers now, and you'll be aware that Liverpool was in the extremely high tier, and other northern local authorities will be going into that extremely high tier. We're currently in the tier 1 or level 1, which is seen as moderate, and We are working hard across the partnership, and we have a local health protection board locally that the university are very much a key partner on, alongside the NHS, and that includes the acute hospital, as well as the police and also the naval base. So we are all working together to try to keep us in the what is seen as the moderate tier. However, across the country, local authorities are now moving up from moderate into the higher and then the extremely high tiers. But at the moment, we are still seen as very much at the lower end of moderate. Mark.
Thank you very much. Thank you very much. So to that and infections and where we are with testing and numbers, one question that's just come through from one of our guests today is how many university students actually do we know have tested positive, and who's in charge of that number? Is that a university thing, or is that a public health responsibility? So do we know the numbers?
If you like, I'll make a comment first, and then I can pass over to Helen. The important thing is that all of the testing that is done, including by the university, is lodged into the national test and trace. And that was one of the things 3 months ago when we started to plan doing some of our own testing that we felt was absolutely critical. So there's no use us doing something parallel on the side. It has to be integrated, which means that the university results are integrated into the results of the whole city. But having said that, because of the good relationships that we have, when the tests are submitted, we get notification, and we know how many within the student population is. As we stand at the moment, in terms of active infectious, if you like, individuals, we have 144 students who are currently active and in isolation, but obviously the people that they have been in contact are also in isolation, but they are not confirmed as having the virus. The interesting thing about that number is, of that 144, around a third, 46, have been identified through our asymptomatic testing. And as I've been talking to DFE and other officials, as the Department for Education, what is emerging, and with our scientists, is that for the younger age group, that is below 25 to 30, many of those young people, if they catch the virus, will not have symptoms. Okay, so I'm left with a dilemma, because by doing more testing, I'm going to identify more people that ordinarily would not be identified as having the virus. So the numbers go up a little bit. So there's a dilemma, and then everybody says, look at that, the numbers are going up. But of course, I want to know as early as possible if students are carrying the infection, whether they have symptoms or not, because that means I can take early action. And the science at the moment is suggesting that young people who don't have symptoms can have up to 5 days carrying a very large load of the virus, and therefore being infectious, until they start to exhibit symptoms. And that's why I'm passionate about doing, among this community, among that young university community, doing asymptomatic testing. And that's why I believe that that is adding to the national knowledge, the national database, and so on and so forth. And we've got some fantastic scientists in the university doing DNA mapping and RNA genomic analysis, and that's allowing them not just to look at the virus, but also identify where the virus came from, which is really interesting, because everybody has a signature on their virus. So we're able to say whether students are infecting each other, or whether it's still virus that they've carried in to the city with them. And at the moment, we don't have very large spots of, if you like, reinfection among the student population. And that's what we need to try and avoid. But the only way we'll avoid that is by getting early detection. So in a sense, for the public listening, yes, the numbers might go up a bit, but just bear in mind that around a third of the numbers from the students we wouldn't have known about if we weren't doing the current testing protocol. And that's allowing us to isolate students early, which I think is a really good thing. And the second part of our protocol that we're moving into now is we're going to systematically go through all our halls of residence and check everybody. Well, not everybody, but sample the whole of the halls of residence and find out information about where the virus is hiding behind closed doors, so that we can see where it is and we can take action. And I'm not sure that we can do much more than that. I would love to be able to test everyone, but I think the government would love to do that, and I think we'd all love to do that, but at the moment there isn't the laboratory capacity to do that. But I'm sure that that will come, and as Helen says, the early hiccups in testing in the national testing programme are beginning to sort out. The big super labs are beginning to operate effectively, and so I'm sure that new testing methodologies are going to appear. The university is working on some of them and developing some of them, and they will start to appear, and that should make large group testing much easier in the future. But for the moment, I think we're doing everything that's reasonable and more than most other universities up and down the country are doing.
Thanks, Graham. Before I bring in on that, just a specific point you mentioned there, and it's because it's a subject we keep coming back to, and some of the questions is that there's a lot of students who aren't in halls residents, who are living out in the community, and they could be just as likely to have COVID and to be popping to the shops and maybe spreading the disease. Are you checking on those as well?
We've got our mathematicians working out a sampling methodology so that we can go. Basically, we will sample 10% of the whole university student population every couple of weeks. But the important thing about that sampling is that because it's randomised, it will give us a very good indication of what's happening among the student community, and that includes the whole student community. And in fact, many of the students, one of the things we were worried about is would students want to go through the horrors of having swabs stuck down their throat and up their nose? It's not pleasant because I've had it done. But the answer is yes. And in fact, students are putting themselves forward because they just want to know. And I think that's really encouraging.
Thanks a lot, Graham. Helen, was there anything else as regards the testing, the results, and anything else that the university is doing at the moment and that you're working on as well?
Yes, so I think I agree wholeheartedly with Graham. I do recognise that as the numbers go up, so the more we test, the numbers go up. That's what happens. I do recognise that causes concern for our residents locally, but I suppose to put it into the context, it is, as Graham says, it's so important we test, because actually then we can identify those students that are positive and ensure that they're self-isolated as quickly as possible and supported. So, it's really important that we identify people, hence why that test and trace is so important that we follow. We've worked really well with the university. We've got a joint post that we've funded that works directly from Graham's university team with my team around the intelligence to check. So on a daily basis, we're under an agreement to ensure that we are maintaining confidentiality of the students. We're checking with the national data that's coming down of positive cases alongside the university data so that we know that we haven't missed anybody. So it's really, really important. I suppose just to say, asymptomatic testing was not recommended early on in the education sector, but we really lobbied hard to get it and get it agreed, because although asymptomatic testing is not recommended for the whole population, actually, if you identify risk groups, it's quite important. So we do whole care home testing for our very vulnerable older residents in care homes, and for that exact reason, that we need to identify cases quickly and put the action in place. And for me, the reality is that the residents, particularly in the halls, in the large halls, they're going to have interaction, and it's common sense to know that the more interaction with people you don't have daily contact with, the more likely you are to get the infection. So it's a really important measure. And I think it has, as Graham says, it's really helped us to identify the measures, which, as he says, also, we haven't seen large outbreaks. We've managed to identify cases and get the contacts self-isolating. So we haven't seen large outbreaks in the university, which I think is really important.
It is indeed. Thank you very much, Helen. I'd just like to bring Rama back into the conversation, who is someone who's living through this as a student. I just wanted to give the panel and give our audience just a sense of feeling of what it's like being a student in Portsmouth in 2020 with all this which is swirling around us. So over to you, Ron.
It's a really good question. I think in the sort of the context of things, being a student at the moment isn't great, purely because of like the media outrage that's been put on students. I think our current Portsmouth students, like I said, have really good behaviour in terms of they're following the rules, and they're not, they are being really responsible, both to themselves and to the community. I think it is very difficult, particularly for incoming students, because of the whole A-level fiasco, and then now it's kind of they're experiencing a whole different university, which was, if you think of university, you're thinking of going out and being social, and I think now they've it's a lot to adapt into that new sort of norm, and I think they've done really well in terms of accepting that, even with like our clubs and our events that we normally do in Freshers' Fair, which is a massive part of being a student, hasn't been put up as much as it normally is, and I think they've taken that up very well. So yeah, I think it's being responsible and adapting to the new norm is kind of what it's like to be a student at Portsmouth.
Thanks, Rama. And is so yeah, without Freshers' Week and without the societies and clubs, are there other things that you're doing as a union? We talked at the beginning about people's sort of mental well-being and pastoral care. I just wondered, are there things you're filling the gaps in, or is it like everyone else, baking bread and joining Zoom quizzes on an evening?
Yeah, I think we've quizzed students out at the moment. We have done a whole virtual fair, so we do have Freshers' Fair, but it's all virtual, and any events that are physical are all following the rules, and it will be with like very few people. But yeah, so we have been putting a lot of things up for students so they're not bored, and there are opportunities to be social even though it's virtual. I know the university have a lot of things in place, UOP Global and everything like that. Personal tutors have been great when students are self-isolating, they're checking up on their students as well. So there are a lot of things that we have put in place to try and make out that you're not missing out on their student experience. It's just something that's maybe different to what used to be the normal university. So it's just something different, really.
I'm hoping that results will be even better this year because students will have so much concentrated time to study hard.
Yeah, let's hope so.
We'll keep an eye on that, Graham. Just to bring back another point as well, Graham, while you had the mic, is you've mentioned something, and I think you're not just saying it. I've evidenced it from what I've read that what other universities are doing. I think the University of Portsmouth do seem to have taken further steps than many others. I just wondered where that came from. What was it that has sort of stood you apart from maybe a lot of what other universities are or aren't doing?
Look, I've got a fantastic senior team, and I really have, and I'm not just saying that. And I think it is about us taking some bold decisions, and we took some bold decisions 4 months ago around some of the measures and things that we're doing now. And everybody has got behind those decisions. That we've not sat in our hands and debated and procrastinated. We just went on and did things. And and pay tribute to things like my finance director, who, when I'm saying, well, we will spend the money on this because health really matters, it wasn't a case of, that's quite complicated or anything. Everybody went, we're right, let's do this. And so there has been a can-do attitude that I'm really impressed with. But I also want to again pay tribute to the collaboration among the people in the city. And we have a great city here, and the size of the city and the way we work together. I think there are some real learning points, I think, from this pandemic. And one of them is the importance of working together. And honestly, the relationships that we have with the police, with the hospital trust, with public health Portsmouth, with the city council more generally, this is the moment when those relationships are tested. And I think when you look up and down the country, you can see that there is fracturing and fractionalisation going on and infighting going on. And honestly, I can say that's not been the case here. We've just got on with it. And that means respecting each other's opinion, not always getting your own way, but working together. So it is everybody in the city that should take credit for where we are at the moment. But of course, I do always add a caveat. I mean, I do not know what the future holds. I mean, something could happen and there could be a spike that's just happened. Of course, that could happen. But I can honestly say with the close working that we've got, we are in a better place than anyone up and down the country, I would say, and I'm very proud of it.
Definitely. You said there that you don't always have answers. Is there anything that has plan in place? Is there anything that has surprised you in a good way that went really well, or is there anything that's come left field and you thought, oh, we didn't plan for that, or we didn't think about that?
Difficult to say. I mean, the bit that I'm struggling with at the moment, to be honest, and this will sound really pathetic, but you know, with the enacting the requirements that we have to do within the campus, one of the big challenges, and you will laugh at this, is the fact that we have to have a rather large ventilation in all of the rooms, which is right. But of course, when you do that within the city of Portsmouth, where there's howling gales quite a lot of the time, then the rooms do become quite cold. So the scratch the head moment is what happens when it gets really cold, because some of those rooms that we are using for socially distanced teaching, that may become a real challenge. And so there's practical and small issues like that, small issues like it was great getting the 90% alcohol, fantastic, you know, sanitizing liquid, not that sticky, horrible stuff that you find, but really high quality stuff. And then, of course, you scratch your head and say, well, where do we store it all? Because it's a flammable like a bomb. So you have to separate it out and bring in steel containers in order to store it. So it's the practical small things that you realize, and I have sympathy with government because what seems like a simple thing can actually be much more complicated than you imagine. But you know, we've overcome these things, and as I say, that's because I've got a great team and great cooperation, and really that's what there will be more things like that will appear, and we just have to work hard, use our innovation, and find a way around them.
Thanks, Graham. Yeah, if I could bring Susie in on this point, on your view from the City Council, and what else you've heard from Graham just from that conversation.
Yeah, I just want to add something, which, I mean, you asked what's different about Portsmouth compared with other places, and I actually think this builds on an improving relationship over the last few years, and probably before my time as well. But let's be honest, September is the time when, as a city councillor, your inbox gets filled with complaints about noise, rubbish and behaviour, particularly if you're in the south of the city, and that correlates with a mass return of students to the city. And so those things are things we've been working with the university about and the Students' Union very successfully for the last few years, particularly around, for example, rubbish and recycling, and students coming from other places in the country and not getting it right, and then residents getting annoyed that the rubbish is all over the place, etc. So we've done a lot of work on that, and actually, you know, the noise and the behaviour are still issues, but they're just within a COVID context now. And one of the things that really was brought to my attention was the fact that actually, with more and more people working from home, that actually the noise is just not limited to a party in the evening, but now it's a real issue, you know, during the day as well. But my argument would also be that's for everyone. That's not just for students. But if you've got a house of multiple occupancy with 8, 10, 12 students, then they're all in the whole time, it's going to be noisier than it might have been in previous years. But a lot of this work, particularly on relationships building, has been built up for many years. And I think that's why, with this thrown at us, that we're able to be very successful in our collaborative working.
Thank you very much. And bringing Marcus back in, the work that you've described, has that been built up on from years of working together, years of partnership, or is this you found yourself suddenly thrown into because of the current circumstance?
Yes or no, the right answer. So if you think about our nighttime economy work, so our licensing teams, how we do nighttime economy patrols on Friday, Saturday nights, the amount of work that goes into that to try and predict. We have a traffic light system, red, amber, green, that determines how many officers we out on the streets in those key licensed areas. That's been going on for a long time. That's a huge amount of work. And all we've had to do is tweak that a little bit to encompass when the students come back. Usually we have Christmas fortnight and we increase officers by X, Y, and Z. But this has been because the students have been returning slower, and then with the 10 PM issue. So it's just been adapting what our working practices were before to meet the demand. In terms of relationships and what we've had before and going forward, well, I've worked in the city for probably best part of over a decade, but as a response inspector and sergeant at PC, I was new to neighbourhoods. So I only landed really probably in the city in around February, March, and then got taken out to do a COVID response team. So I only came back in July. What I've been really impressed and pleased with is how easy it is to pick up the relationships with the council, where I'm on the public health board on the Fridays, and with the university. I think that just, if I'm honest, it sounds very sycophantic to everyone here and everyone who's listening, but Portsmouth and Island and the people that we serve here are proud of the city, and the people that work here clearly are proud. So starting those relationships was really easy. I haven't always found that in other parts of Hampshire where I've worked. I am biased because I'm from Portsmouth, but building those relationships has been really, really simple for me. I found very little barriers with the university, with the council, and the public health board, and with the councillors. To get that communication going, it's been really, really simple. I think that comes from we work on an island, a bit of an island mentality where we're very protective and passionate about the city. You won't find that everywhere else in the country. So I think we're on a good start. So my job has been made a lot easier because of that.
Thanks, Marcus. Thank you very much for that. I'm just conscious of time. We're into the last couple of minutes now. So probably just a final question to yourself, Graham, and again, changing the subject completely. Through this process again and looking at numbers and how many students were going to be coming and how many were going to be deferring, the international students, there's a lot of discussions over the summer about the strain this is going to be putting on university resources and university finances. So final question is just where is the university at the moment as regards its financial position, and how much of an impact has the current situation and the impact of that moving forward going to have on the university?
Yeah, well, thanks for that. I mean, I think the first thing I would say is that the biggest immediate worry I have is the amount of incredible work that my colleagues have done, because honestly, they're exhausted. They have worked so hard, and there has been no respite for them. So the first thing I would want to do is pay tribute to the incredible support I've had from my colleagues, going way beyond expectations, because they love the university and because they want to do the best for their students. And that has been extraordinary for me and quite humbling. Of course, everybody's worried. I am worried about the finances, and there is absolutely no doubt about it that this will be a pretty horrific financial year for the university, probably the worst financial year since the university was founded. But balancing that against the fact that the university has been prudent and sensible over many years, and we have a reasonable cash reserve. Now, I would rather not spend my cash reserve on a situation like this, but as many people say to me, well, do you not save for a rainy day? Well, it's pouring now. It is, the rainy day has come. And so we will use our cash reserves to see us through this next year, but we're able to do that. So we're in a position that most other universities up and down the country are not in, and that we can afford to run a deficit of 20, 30 million pounds next year, and we can manage to do that. But the important thing for me is this is a time to be investing in my staff and in the university, not a time to be disinvesting. So some of the big plans that we have, I'm determined that we go ahead despite that large deficit, because actually I want to build this university strong, not for now and not for next year, but for the decades ahead, because it's a really important intrinsic part of this city. And it's really important that we have a strong university. And so I'm determined that we do that. But we are in a fortunate position in the fact that we have been prudent over many years. And as I say, that gives us a strong balance sheet, a strong cash position. So yes, it's difficult, but no rapid and irresponsible decisions are going to be made by my team about the future. We are going to accept the deficit and move through it and hopefully come out the other side stronger. So that's kind of where we are at the moment.
Okay, thank you much. Thank you very much for wrapping up with that, Graham. Thank you for your honesty in answering the questions. Also, thank you very much for everyone on the panel. So Helen, Susie, Marcus, Rama, thank you very much for giving up your time for this university event. As I say, it was an event that was put on by the university to be able to answer questions from people. So thanks for everyone who's joined us this afternoon. I hope you've enjoyed that. Sorry we couldn't get through all the questions. I was going to leave myself space at the end to do a wrap up, but I don't need to, because everyone said it for me, because I think the thing that's come across loud and clear from this is that we love Portsmouth. It's a city that we're proud of. We all work together as a city to do what's best for the city. And I think sitting here as a moderator, that's the message that's come across loud and clear, that everybody is working together to ensure that the students, the city as a whole, can be as safe as possible moving forward. So I thank everyone for the time. I wish everyone the best of luck for the rest of the day. And hopefully we'll meet up soon.
Thank you, Mark.